Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide. Lithium therapy. So firstly, we are going to see about the indications. So where it is used? It is used in case of the mania as well as the hypomania. Next, it can also be used in case of the bipolar disorder. So now looking at the blood levels. So the blood levels, there are two categories. It can be due to therapeutic and the prophylaxis. So therapeutically, there can be about 0.8 to 1.2 milliequivalents per liter, whereas in case of this is mainly to treat the acute mania. Then comes the prophylaxis. So prophylaxis is basically to prevent the relapse of the bipolar disorder, and this is about the 0.5 to 0.8 milliequivalents per liter. So you may think, what is the toxic level of lithium? The toxic level of lithium, it includes toxic level, it is basically greater than the 1.5 milliequivalents per liter. So now we are looking at contraindications. So what are the contraindications? Contraindications include the CKD, next includes the heart diseases as well as the hyponatremia or the diuretic use. So what are the baseline studies to know the levels? So the baseline studies include, there is the BUN, that is nothing but the blood urea nitrogen. Next, what is included is the creatinine. Creatinine can be included. Next, the calcium as well as the urine analysis. Then comes the TFT, that is nothing but the thyroid function test, and also the ECG. So ECG is done in patients with the coronary risk factors. So now moving on, we are looking at some of the acute adverse effects. So the acute adverse effects, it includes, so this is specifically the acute. So in case of specifically acute adverse effects, this includes the tremors, ataxia, as well as the weakness. Then it also includes the polyuria, polydipsia. Then also the vomiting and diarrhea and the cognitive impairment. Now this was the acute. Now moving on to chronic. So in case of chronic adverse effects, so this includes the nephrogenic diabetes insipidus. Then comes the thyroid dysfunction and the hyperparathyroidism.